Excellent. All right, well, good afternoon, everyone. This is Bill Keck, your moderator for today's session. We're delighted to have you all with us. Our agenda today is fairly straightforward. We're going to give you a few updates about the Academic Health Department learning community and then move ahead with the two presenters that you've learned about in the emails you've already received from us. But before we get started, I think I might ask Kathleen to go over a few housekeeping issues associated with the webinar. So, Kathleen Amos?
Thanks, Bill. So, yes, we just wanted to mention a few housekeeping items right at the start. So, first of all, you probably heard, depending on what time you logged in, that Janelle has muted all of the lines on the call. We will have some opportunities for discussion towards the end, but for right now, if we open the lines, if you could make sure that you're keeping your phone on mute when you're not speaking, that would be really helpful to cut down on the background noise. As well, if you are on the phone, you may want to mute your computer speakers so you don't get an echo as the audio is being provided in both formats. Janelle has uploaded, you'll see at the top right-hand side of your screen, a little box that says Files. So if you'd like to download the presentation slides that we'll be using today, you can do that there. As well, you probably also heard that we are recording the meeting today. So we will be archiving it, and that archive will be sent out following the meeting. So you'll have access to that after the meeting as well. And finally, we encourage you to ask questions, share your comments as we have the speakers speak today. You can do that using the chat box, which is at the bottom right-hand side of your screen. So feel free to type your questions and comments at any time. We will, as I mentioned, have some breaks for discussion following each of the two presentations that you're about to hear. But feel free to send your comments along throughout, and we'll make sure we address those when we break. Thanks. That's all I've got, Bill.
All right, excellent. Thank you so much, Kathleen. Now, just a couple of quick updates. I think many of you probably know about the mentorship program that we've begun at the learning community. It's formally launched just about 6 months ago, about the end of 2015, so we've been going about a half a year. And we're using it as a mechanism to connect individuals who are seeking guidance in some area of academic health department development or operation with those having experience in that area, with a focus on creating ongoing relationships that hopefully will support mutual learning and professional development. We're fortunate to have this effort led by one of our members of the learning community, Bryn Manzella, from the Jefferson County Department of Health in Alabama. And currently we have a number of mentor and mentee matches going on, and we've been receiving a reasonable amount of positive feedback with work going on in a variety of different elements related to academic health departments. We're always interested in having more mentors because we try to make the closest matches we can between the experience of the mentor and the question or needs of the mentee. So as we kick off the new year, it's a great opportunity for any of you on the call who might be interested to get involved as either a mentor or a mentee. You can certainly go to our website and find more information about the mentorship program there. You can access that from the Learning Community webpage at the Public Health Foundation website, phf.org/AHDLC, or just contact Janelle Nichols, jnichols at phf.org, to let her know that you're interested, and we'll see that you get involved with us. And the second update refers to the newest activity of our learning community, which is the development of a research agenda focused on academic health department partnerships. This effort has grown out of a suggestion made during The Council on Linkage Between Academia and Public Health Practice meeting in August of 2015 was made by Vince Francisco, who I think is on the call. So, Vince, a formal shout out to you, thanking you for that idea. What's going on now is that our learning community member, Paul Irwin of the University of Tennessee Department of Public Health, is leading a small group that's developing an initial draft. And that draft is expected to be completed by the end of this month. Once the draft is ready, we'll be sharing it with the learning community for review and using the feedback received to try to refine the draft. And once it's refined, we'll present it to the Council of Linkages for their review and hopefully for their approval. So watch the learning community listserv for more information as this project develops, and feel free to send any questions you may have about it or suggestions to Kathleen at kamos@phf.org. So with that, then, I'd like to move ahead. As Kathleen mentioned, we welcome your questions if you put them into the webinar site as we go along. Our intent is to try to get questions related to each presenter done at once, but if we have a lot of questions that take a long time, we will stop and go on then with our second presenter. So first up is Dr. Vicki Colley-Akers. He was the Associate Director of the Health Promotion Research at the University of Kansas. So, Dr. Colley-Akers, if you would, please, the floor is yours.
Thank you, Dr. Keck. Thank you also for the opportunity to talk a little bit today about the effort that we have occurring here in Kansas. I'll be talking about our effort to develop an academic health department as a means of promoting strong public health practice. And I would be remiss not to mention my colleague Dan Partridge, who is the director of the health department, the Lawrence Douglas County Health Department here, who contributed substantively to this presentation. For today, I'll start by providing some background and then describe our process for establishing and maintaining the academic health department, as well as our lessons learned, and then I'll close with some implications that we believe are clear for public health practitioners and academics. Our academic health department is a partnership between the University of Kansas and the Lawrence Douglas County Health Department. So I'd like to tell you a little bit about both of those organizations. The University of Kansas is located in central Lawrence, Kansas. It's a high-volume research university that serves about 25,000 students. The university does not have a School of Public Health, and there is no School of Public Health in the state of Kansas. But our university does have a number of research units and departments that contribute substantively to public health and community health. I'm part of the University of Kansas Work Group for Community Health and Development, and we're part of the Applied Behavioral Science Department, which supports a joint MPH and PhD program. Our faculty and staff within our research unit have worked with local health departments only as one of many partners, but not the primary partner, since about the early 90s. The Lawrence Douglas County Health Department has worked with academic partners on an ad hoc basis for very specific projects, not a long-running relationship, and they generally had a limited connection to the University of Kansas. Douglas County is a jurisdiction that consists of about 110,000 people, and the health department is staffed by about 45 people. It is recognized across the state as a high-performing health department and received accreditation in May 2015. Our partnership really began when the Lawrence Douglas County Health Department reached out to our research unit to develop a partnership to support their efforts to complete a community health assessment and community health planning process that are required as a prerequisite of applying for accreditation. And what we noted during that 18-month process was the presence of a number of factors that suggested that a deeper relationship would be beneficial for both organizations. These factors included good collaboration from the start, true collaboration that really included sharing of risks, rewards, responsibilities, and resources. We also both organizations emphasized co-learning of staff from both organizations, which occurred really from the beginning. We also noted the presence of shared values pretty early in our partnership. These included a focus on population health, and less on a programmatic approach, as well as recognition of the role of social determinants in contributing to health issues that we observed. Lastly, the leadership at the Lawrence Douglas County Health Department really has been working for continuous improvement for a long time and are very much interested in transforming public health. All of these really laid the good groundwork for a deepening partnership. So upon completion of the community health assessment and planning process that the University of Kansas supported, the health department approached us to deepen that relationship and asked us to consider whether or not an academic health department made sense. And both parties really reviewed a lot of documentation to better understand what academic health departments were or are supposed to be, and we certainly found definitions and examples, but no prescriptions. And at the time, there was a real scarcity of documented cases of academic health departments that were not located in the School of Public Health. Our leadership held meetings to discuss common values and began laying out a memorandum of agreement. The memorandum of agreement that was established included several elements, including partnership principles. Those included promoting co-learning about community health and improvement, respecting the unique nature of each partner and the contribution of each partner, and trying to strive for equality in respect and contribution. Establishing clear and open communication by striving to understand each other's needs, interests, and potential contributors. In addition, the memorandum included agreements about what activities would be included, as well as the scope of work. And when we first established this in 2013, it included an initial time frame. We kind of viewed this as a one-year experiment to see if we could achieve something that was mutually beneficial, that resulted in the aims that we had of improving public health practice, improving capacity building, improving opportunities for learning. So we did view that initial time period as a sort of experiment, if you will. In terms of establishing the academic health department, we did run into a few challenges at the very beginning. We had to work hard to make sure that the health board and staff saw the value of undertaking a partnership like this. Sometimes, you know, what we anticipated were outcomes that were maybe more distal than one would see in the first year, so we had to get buy-in to the overall process. In addition, it was challenging to determine who would sign at the university for our agreement. It wasn't clear that it was something that a chancellor would sign in the case of our university, that it wasn't something that a single principal investigator would sign either. So we had to spend some time trying to figure that out. Since its inception, we have implemented a number of practices, if you will, independent of the individual activities that are part of the academic health department that are aimed at maintaining that academic health department relationship. These include having an annual study session with our health board and University of Kansas staff to identify goals and directions for the next year and or few years. Our team and the health department team have monthly leadership meetings to keep track of where we are and what projects are emerging. We do share some staff, so a tenth of one of the KU work group staff people comes from health department support. We also have shared meetings between their community health team and our research team. And then we always look for synergistic funding opportunities that would help our team move forward with some of the research questions that we're particularly interested in, but also would help move forward public health practice here in Douglas County. So over the course of that first year of an experiment and then the subsequent 2 years that we've taken to institutionalize the academic health department, a number of successes have been achieved. Foremost among those are some achievements around capacity building of staff and students, which really have taken informal and formal approaches. We worked in the first year to work with health department staff to complete formal coursework related to public health competencies with shared costs between the university and the health department. We also have done shared journal article reviews around specific topics such as emerging research and conceptual pieces. For example, our teams reviewed the chief health strategist literature that has recently come out over the last several years. We are continuing to adjust our efforts to make sure that capacity building occurs between staff, and are moving some of our journal club efforts or journal review efforts to the health department to make it easier for their staff to engage in those conversations. In addition, we have worked on capacity building of the students that are part of the university. And overall, 32 students have been placed at the health department since 2013, but this does include a large number of nursing students as well as journalism students that participated in a project that I'll talk about in a little bit. Additionally, another success has been the development of an evaluation system to support their growing community health program, as well as evaluate progress on implementation of the community health plan. And we're also working to see how it can be integrated into the health department's goals to work on a community balance scorecard. Another accomplishment has been the support of accreditation in 4 of the 10 domains that were part of the accreditation process. We also learned that the principle of the academic health department not remaining in one section of the university has been really important. So there have been a few key projects that have integrated other centers or other schools within the university than just our originating center of the KU work group. These included a project with the Performance Management and Quality Improvement Laboratory here at the university. This resulted in a change in the clinic hours of the health department to be more efficient and effective in meeting the needs of Douglas County residents. In addition, we worked with the School of Journalism to help generate ideas for how the health department could undertake a branding effort that would brand the health department for Douglas County as not just a place where you can receive immunizations, but rather a place that contributes to the quality of life of Douglas County residents. Both of these engaged students as well as staff, and I think resulted in a lot of lessons learned on both parts. In addition, it did lay the groundwork for the receipt of a CDC Partnerships to Improve Community Health, or PITCH grant. This grant started in September of 2014 and is working to address healthy eating, active living, and tobacco. In addition, we hope that it's really the start of achieving our shared goal of contributing to the evidence of what works in public health. Along with these successes have come a number of challenges. We have found that operationalizing our vision takes time and thinking through, and we're still working to sort of get right, if you will, the practices and activities that ought to be included in the academic health department. We've also learned that some parts of the university are less open to community partners than others. I mentioned a few labs and schools, the School of Journalism and the Performance Management Lab, that were very open to solving some of the challenges that the health departments are facing, and we haven't always received that openness or willingness from all of the academic units that we've approached for partnership. We do find that it is an ongoing challenge to communicate the value of the academic health department to all staff, both health department staff as well as academic staff. I mean, it is something that is somewhat abstract, particularly in the beginning, and we've had to work to make it more concrete and communicate pretty consistently about the importance of the academic health department. And then lastly, I'll just highlight that it has taken time for us, and it's probably a continuous process, to understand the stakeholders for both organizations. That is, who matters to both organizations and what do those folks care about. And as I mentioned, it really has been a continuous process to better understand those audiences or important groups of people for both organizations. In closing, we do believe that our experience has told us that there are a number of implications that are important for public health practitioners and academics. For practitioners in particular, we do believe that it offers an opportunity to build the capacity of the existing workforce. It also can be useful in supporting several accreditation activities and an overall strengthening of the local health department and public health practice. And lastly, I think it offers an opportunity for local health department staff to engage in participatory public health research. For academics, we believe that the academic health departments can present opportunities to learn in community settings for faculty, staff, and students. In our experience, it's easy to think about placing students in community settings and more challenging to place faculty and staff, if you will, in learning opportunities out in communities, but it really has been immensely beneficial. In addition, academic health departments offer potential for expanding the evidence base about what works in public health and testing interventions and tools collaboratively in real-world settings, which I think we can agree is an outstanding benefit. I'm happy to take questions at this time and also welcome you to email either myself or Dan if you have any additional questions.
Well, thank you very much, Vicki. Looking now to see if there are any questions. You can either type them in as questions, or those of you who are connected by phone, please feel free to ask them at this point.
And if you are on the phone and would like to ask a question, it's just *6 to unmute your line. And it looks like a few people are typing questions in right now, Bill.
Mm-hmm. Yes, here we go.
Okay, so I'm seeing a question, what kind of support did you get for accreditation? That might be another question that we could address to Dan Partridge for the overall support that was given for accreditation to the Lawrence Douglas County Health Department. I can tell you that the academic health department contributed in a number of ways, including supporting the community health assessment and community health planning, as well as providing documentation for how they were working to link evidence-based public health practice, as well as their efforts to mobilize partnerships across the community. Okay. Another question is, what kind of specifics were included in the MOU and MOA? That's a great question. We established our MOU or MOA based on some of the examples that we found, and there are several examples. Janelle, are you able to hear?
Sorry, yes.
Mm-hmm.
Okay. Sorry.
Please continue.
Okay. So lost track of thinking there. My apologies. So we did some examples that were present and kind of used those as a starting place. As I mentioned, we really did focus on making sure that there were two key elements that were written out as part of the MOU, including partnership principles, so those things that would just kind of govern how we would work together. And I think in the slides we included some of the examples. In addition, we did get into some nuts and bolts of some activities for the first year, including how we would shape some of the co-learning opportunities by participating in research group and offering at least two formal learning opportunities, for example. And we would be happy to share our MOU if that helps.
Mm-hmm.
Okay. All right, I'm trying to make my way through these questions. The next question that I saw was, can you please discuss your evaluation plan that you see that you use to record successes and outcomes? We use the community checkbox, a community evaluation system, which is really intended to support community initiatives that are addressing community health and development issues. It's a comprehensive system that allows partners to document their activities for implementing an action plan, for example, but also to warehouse longer-term indicators that would be included in a community health plan, and that is used pretty regularly. You're welcome to view their site. It is open to all. We have an open that was one of the values of the health department, was to make that an open evaluation system. So you're welcome to view that at healthydouglascounty.org, and then we'd be happy to talk to you about that more. Sorry. Which of the 4 accreditation domains does the academic health department support? I need to look that up to be certain. I believe it was domains 1, 5, 9, and 10 that we officially supported, but I would want to make sure that that was part of it. We were an integral part of their accreditation effort, I think, and supported the site review as well as some of the documentation that occurred. And I think that either Dan or I would be happy to talk to you in much greater detail about that if that would be helpful. You're welcome to email us. All right. This question is, in partnership with the School of Journalism for branding, what did students get? Academic credit, payment? It was a part of a project. So this was a year-long learning experience for the students. Our journalism school has one track for students called Strategic Communications, and they usually spend a whole year kind of working on a strategic campaign. And we worked with the professor that would guide that strategic campaigns class, and were able to get him to undertake this project as part of that. So they did get course credit. In addition, it was a pretty comprehensive effort, I will say. So I think our health department staff, Dan Partridge and Charlotte Marthaler, who I think are listening, traveled across the country, really, with the journalism students to learn what other health departments, I believe they visited 6 other health departments, were doing as branding. So it certainly was an instance where they got course credit for doing it, but I think the learning probably went far beyond just making sure they had the courses. And I will share the MOU. The next question is, what do you think you were able to accomplish that you wouldn't have been able to do without working with the Lawrence Douglas County Health Department? So I think there have been a few key things that we've been a part of with the local health department that have been really helpful. One of which I can't overstate at all, which is that it really has provided a real-world learning experience for our staff as well as our students. We had pretty deep experience in different assessment methodologies, but the opportunity to do that in our own backyard had not been presented before, but also to give our students a real experience to operationalize some of those methodologies has really been critical. And I just can't state enough that we have learned, our staff, our faculty, and our students all have learned a lot about public health practice from being a partner with the Lawrence Douglas County Health Department. In addition, I think their keen interest in creating a shared evaluation system and a shared set of data is something that people are really attentive to because of the concepts of collective impact. And we really have been able to refine some of our thinking about that as we've worked with the Lawrence Douglas County Health Department to refine their evaluation work. The leadership meetings, that usually is Dan Partridge, the director of the Lawrence Douglas County Health Department, and myself that do the monthly meetings. And then annually, the health board, as well as a bigger set of our leadership staff, participate in the study session to guide the work. And then shared staff. So we receive a contract from the health department to have a staff person, me, be part of the health department staff for about 10% of my time. It helps kind of reduce some barriers to engagement and just helps us create more specific time to assure that we make progress on our academic health department goals. And I think lastly, probably, the School of Journalism Partnership. How did they fund the travel with the students? I believe the health department funded it, and I would have to ask a few more questions about that to be more specific. But I believe the health department supported a lot of the travel. And I think the last question is any collaboration around the opioid crisis. That hasn't been a presence in our community or one that has been the focus of our academic health department work.
Mm-hmm.
I believe
all right. It looks like there are one or two other questions coming in. Let's see. Wait just a moment, but I'd like to move on shortly to hear from Louise Kent. Perhaps, Vicki, you could take a look at the last question from Regina Hutchins.
Sure. So this last question is about a large health department with 240 FTEs, and the person is asking if a health department can initiate an academic health department with more than one university. I'm not sure that I'm the definitive expert on that, but I think that that there are unique attributes and contributions that occur across many universities, and to the extent that you're able to use a relationship like an academic health department to leverage those resources, it's a good opportunity, and it's good to explore how each university can support your efforts.
I think that's an excellent answer. Thank you so much, Vicki. And thank you all for your questions and participation. If you continue to have questions for Vicki, please, it's all right to type them in, and we'll try to come back and visit those questions at the end of the session. But now, in the interest of time and fairness to Louise, I'd like to move on to Louise Kent, who is the Planning Administrator for the Northern Kentucky Health Department. So, Louise, please let us hear your story.
All right. Good afternoon, everyone. I wanted to share with you an academic health department with the flavor of Northern Kentucky and how we've done it here. I'm going to pass through the learning objectives. Hopefully I'll hit on all of these as I move about through it. I think most of us on the call already know what the definition of an academic health department is. Dr. Bill Keck actually wrote some papers on this, and you can find them on the Public Health Foundation's website. So ultimately, the purpose of having an academic health department is to improve the population's health where we work. So it also strengthens, of course, the linkage between practice and academia, and of course enhances so many things. In order to build your foundation, you got to build a strong one. You don't have to be a large or an urban health department to become an academic health department. However, you do need to have a strong foundation in place to be successful. You've got to realize that this linkage is a way to better prepare for all of the changing roles and challenges we face in the field of public health today. One of the foundational building blocks is to identify a point person to help develop and to coordinate all the activities that will take place. And then, of course, to establish some internal processes and documents so everyone is on the same page. You also need to strengthen and establish partnerships with each other and sort of ask the question, what does each party need for this to be a success? It's not about the health department, and it's not about the college or university. It's about the partners. And then, of course, the other foundational aspect, which Vicki has already mentioned, is establishing signed formal agreements. A lot of value and benefits from having an academic health department. Foremost is really for an opportunity for students to practice new skills on current problems, especially those that are happening in the field right now. In the next couple slides, we'll talk about the rest of the items I've mentioned on this bullet here. For workforce development, you gain better qualified professionals that provide public health services in the community. Excuse me. And there are lifelong learning opportunities with this type of an association. Excuse me, I've had a cold recently. There's an ongoing role for universities to assist health departments in achieving a proficient workforce. Health departments need to respond to expanding and ever-changing demands in the field, and ongoing workforce development is really essential to keeping staff current and well-prepared. There are many ways that academia can help. There are weekly seminar services, series, that are available for staff. There may be public health leadership institutes and other training sessions that can help with specific workforce needs. Also, as Vicki previously mentioned, there's translation of public health research. Faculty have such broad expertise in research. This is a tremendous resource to any health department. Health departments also, though, can help define public health research issues. They can help form research questions, assist in the design of a research project and in conducting the research, assist in interpreting the results, and work with academia to translate that research into actual practice. This really helps in meeting FAB accrediting requirements and all as well, and it adds to the evidence base for best practice approaches. As for public health practice, university faculty can engage in the health department's activities in the communities they serve. They can do things such as leading focus groups, collaborating on grants, assisting with community health assessment and improvement activities, assisting with data needs, providing consultation or technical assistance. And it's a value in having ongoing discussions in the field of public health as it transforms to better address the population's health. For students, there are opportunities for community-based internships, practicum experiences, capstone projects, service learning projects, observations, and it really enriches the classroom studies with practice-based learning experiences. For health departments, students bring skills, fresh perspectives, energy, and enthusiasm. There's a lot of assistance when they come alongside someone in the workforce to assist with research or community-based initiatives. And for the university, the health department staff can provide presentations on current public health initiatives in the classroom and provide examples of how new technologies and tools are being used in the field. Health department staff can also serve as adjunct or voluntary faculty, providing that local public health viewpoint in the classroom. And as Vicki mentioned, we can serve on working committees and advisory boards at the university, providing that local public health voice into the discussions and decisions. Also, we can participate in practicum and career fairs, which is a real boon for both the students and the universities. You can really maximize and target the use of the scarce resources we're all experiencing these days. The graduates, as I had mentioned, are better prepared to enter the workforce. There are enhanced career opportunities for those graduating, and of course, enhanced hiring opportunities for health departments. Once we've been able to have a student here and observe their work, we know how they are in terms of possibly filling a vacant position once it comes open. We have an application process at the Northern Kentucky Health Department. It's an online application that students can readily access from home, or work, or anywhere. It has contact information we can get about not only the student but the advisor, number of hours they need, areas of interest the student has, other information, and once that's filled out, I can then download it into a database. We try to make our application process as user-friendly as possible. We also put affiliation agreements in place. As with Vicki, I would be happy to share a template for our affiliation agreement. We have a standardized template we use with every academic institution, and it's fairly comprehensive. We're always looking for ways to improve it, but for right now, this is what we're using. It's worked out very well. In answer to someone else's question, we have affiliation agreements in place with over 40 academic institutions throughout the United States. but we do have a closer working relationship with the colleges and programs that are closest to our health department. So while I can't go to Maui and contribute with an academic worksite or a committee there, although I would love to, it tends to be a little closer to home. We also then, once I get, and I'm the point person, once I receive those applications, I contact prospective preceptors in our health department. Could be staff in any of our divisions, depending upon the student's interests and what they need to accomplish. And we set up a face-to-face interview. We have standardized student interview questions, and we do these interviews face-to-face because this is actually a very excellent skill for that student to work on. As they'll be heading out into the public health field fairly shortly. We also, of course, do have onboarding processes with them, make sure that they're set up by the time they're here. And they also, through orientation, learn about policies, things like dress code, and a little bit about our organization, our values, our vision and mission. We also have put together a student preceptor checklist. This is a very simple checklist. It's a one-page that the preceptor uses to document total number of hours the student completes, and then at the end, the student and preceptor sign and date the document. The signing is done in this order to make sure that both the student and the preceptor are on the same page. It's the number of hours that were completed. And the reverse of this page is for the preceptor to briefly bullet the student's accomplishments that added value to the services of the health department. And this allows us to have documentation of all this meaningful contributions that the students make when they're here. We also have a student learning agreement. This is a document that many universities have. We've sort of standardized ours here. Has basic contact information. We leave a place on there for learning objectives. We identify in writing the students' activities and responsibilities while they'll be here, plus their deliverables, and then we have it signed and dated by the student, the preceptor, and the faculty advisor. And this really ensures that everyone is on board with the expectations and is in agreement at the outset. And this document, in fact, all of our documents, which sound like a lot, actually have saved us many times when maybe students didn't quite understand what their responsibilities were back to us, and so we were able to obtain some needed data and data analysis that our staff could then use to continue on with the programs after the student left. And of course, the final part is we do send out a SurveyMonkey evaluation to the students because we want to hear from them what we need to do to make learning experiences more valuable and more meaningful to them. We, of course, fill out evaluations from the universities, and then I meet with the nearby universities to sort of go over how we are doing, what we can do to improve, and so that we're always on the same page, and making improvements as we move along. We also have an avenue for students that are doing capstones or other people that wish to do research projects with us. Again, it's an online form. We have some agreements in place, and we've created what we call the research review team. It's an internal team of upper management that reviews every capstone or research project application, and we've got a list of standardized questions for that too. It's been very helpful for us in determining whether or not we can and should move ahead, and it also at the same time keeps everyone in management aware of the various research activities going on at our health department. From the University of Kentucky, they have provided, here's a list of things where they have provided assistance on a list of contemporary issues that we have dealt with. You can see it deals with substance use, medical needs, all kinds of things. They also get hold of us or we get hold of them sometimes and ask for literature reviews. When we're in the midst of a project or a member of Board of Health is asking for some evidence around a particular topic, the academic institutions have come through time and time again to provide us with the information that we don't have direct access to, but they do. It's really wonderful. And then sometimes they just sort of get hold of us and say, hey, I found this interesting article. Can I send it to you, or can we talk about it? And go from there. There are successes with students. As I've mentioned, they get training and mentoring from people who are actually in the field. They get some real in-depth knowledge and experience, and they get to actually see what's happening and to see everything they've learned in the classroom translated out into the field. For faculty, they get to deepen their understanding of public health practice, increase relationships with the public health practitioners, and hopefully work together on grant opportunities. And providing service is really an essential component of promotion and tenure, and this is a really excellent way for faculty to gain that and maintain tenured opportunities in their careers. For the academic institution, graduates get to secure some appropriate jobs. There's successful accreditation of programs, and then there are more public health research opportunities through these types of linkages. For the health department, we get to locate qualified people to fill our positions. We also are supported with accreditation requirements. Our staff have opportunity for more career growth, and the student projects really meet a need. When we bring students in, it's a win for the student, it's a win for us. It's never just one-sided. We always try to make it work for everyone that's involved. We have had over 60 internships or practicum experiences at the health department. And we've had 11 former students who were hired by us, and 2 former students were hired during the past year, and 1 actually in the past 3 months. So it's been very advantageous for us to work with them. These are some of the projects that have led to a tipping point. These are, as I said, projects that some of the students have worked on when they've been here. You can see that there is just a variety of opportunities for growth for students when they come to our health department, and I'm sure at any health department. And this is really just a sampling of what's going on here and what they can accomplish. Some of the lessons learned basically is that it starts from the top. You've got to have top approval to have an academic health department and for it to be successful. You also have to understand that collaboration, or really understand that collaboration is the only means to meet some objectives. You just can't meet them alone anymore. It takes partnership. Again, someone needs to be that point person. You got to have policies, procedures, etc. And then it's not only important to establish relationships, but maintain them. So it takes that checking in with each other, the emails, the calls, or maybe even the face-to-face. You also want to make sure everyone's needs are met, make it win-win for everybody, the formal agreements, build on small successes, and then just keep going from there if you're just starting out. And then, of course, the students, try to be as flexible as you can. If you've worked with them, you know what I mean. You know, just keep the communication going with everybody. As I believe Janelle had mentioned earlier, we do have, you're all a part of this. If anybody's new on the call, just contact Kathleen Amos to be a part of this learning community listserv. And I'll open it up for questions and answers from anyone.
Thank you very much, Louise. So this is the opportunity for those of you who are typing in questions to do so. And if any of you would like to ask a question over the phone, just unmute your phone and please move ahead. I think it's *6, correct, Kathleen, to unmute a phone?
You are correct. And also, I just wanted to point out, Ron added a link to the chat box as well related to accreditation. So there were several questions earlier in the call about how the AHD helps with accreditation. So we actually did a webinar early last year with Jessica Cronstadt from the Public Health Accreditation Board, and that archive is available on our website as well, and gives a lot of examples of how AHD relationship can potentially contribute to accreditation. So like I said, Ron put the link in the chat box if anyone's interested in checking that out.
All right. I see that some folks are typing, so Louise, watch that space.
Okay, I'm watching for it.
There you go.
I think they want to know Kathleen's email for that listserv so they can get on it. I believe it's kamos@phf.org. Is that correct?
That is correct.
Okay, they can just email Kathleen at kamos@phf.org if you'd like to join the listserv. Okay, someone has said they're really interested in recommending that their health department become an academic health department. Oh, they're near me over in Cincinnati. Asked if I'd be able to present this. Absolutely. I am, like I said, I'm probably only 15 minutes away, so Regina, feel free to contact me and we'll set it up. Anybody else have other questions? Regarding the research review team, do they review only capstone projects? No, if there's a faculty member or someone else, another researcher that wishes to engage our staff or our clients in any kind of public health research, we review everything together as a team. How many members? They are the directors of our 3 program divisions, myself, and the director, our district director of health. So it's just a fairly small group on our research review team. There is a format. There's actually a form they need to fill out that lets us know exactly what they are proposing to do. We ask about IRB approval, and we actually have a research policy that covers almost everything, and we felt we needed to put that in place to spell things out. If people go to our website on nkyhealth.org, they can actually see that there is a link for research projects. They would just look under the Northern Kentucky Public Health Institute. And we do it as often as we receive applications, which is not really all that often, so every once in a while. Is my position partly funded by a university? No. We have not, I guess you might say, advanced to that point. We just sort of set this up ourselves. My position is paid 100% through local tax dollars. We'd love to be able to set something up with the university. It just has not occurred at this time. So, other questions? I'd be happy to answer any other questions people might have or any comments.
All right.
And if you have you see my email address. If you are interested in receiving any of those documents, let I think Janelle know about it, and I will send her PDFs of anything you're interested in, and then we can get those things out to you.
Mm-hmm. Yes, and it might be a good time also to remind folks that you might want to check out the Academic Health Department portion of the Public Health Foundation website, because there are a number of tools there. There are some examples of affiliation agreements and so on, other things there that you may find helpful if you haven't yet taken a look at them.
Yes, and I will say that when we started this out back in 2008, I shamelessly borrowed from my peers in the field and in some instances cobbled things together and worked on them until we were happy with them. So we have no problem sharing. We're in public health.
Mm-hmm. Okay. And Ron, you've just made a comment that if the speakers will agree, we'll post MOUs and other documents on that Learning Community website. We'll add them to those that are currently there. So I assume, Vicki and Louise, that would be okay with you?
That would be fine.
Absolutely.
Mm-hmm. All right. Are there other questions? All right, someone is typing. Meanwhile, Louise, I hope you get a chance to rest your voice and fully recover.
Oh, I am so sorry. I picked up a terrible cold last week, and now I've got this lingering cough. So as I'm hacking away, I'm sure all of you were entertained. Anyway, you've got my email address. If you want to just email me directly to, that's fine. And then if anything comes up that I think would be of general interest to the entire listserv, I'll be sure to share it with Janelle.
All right, excellent. Well, I think then that indicates that we are coming to the end of the webinar. Let me ask Kathleen, Jennifer, Ron, if you have any final comments you'd like to make.
Thanks, Bill. This is Kathleen. I just wanted to really quick mention an opportunity that's available through Centers for Disease Control and Prevention right now, which is the Public Health Associate Program. And it was suggested to us at one point that an academic health department kind of arrangement could be a really interesting site for an associate. So the Public Health Associate Program is a training and development program that provides opportunities for recent graduates to gain experience in the day-to-day operations of public health programs. And both health departments and academic institutions, as well as a variety of other organizations, are eligible to apply to host an associate. So if you are interested in that, the host site application period is open right now until the 22nd of January. And there's a lot more information on CDC's website, and it's just www.cdc.gov/PHAP, so Public Health Associate Program. And Ron, it looks like just put the link in the chat box as well, so you have that.
Mm-hmm. All right, excellent. Well, let me extend a hearty thank you to both of our presenters, Vicki, Louise. Their presentations were excellent. And also thank you to all of you who have joined us today. The participation was outstanding. I think we got a lot of information. Does anyone have any final comments that they think might be helpful to those on the call? All right. If not, our thanks to you. Stay in touch with us. We'll stay in touch with you for the next webinar or meeting of the Academic Health Department Learning Community. Thanks so much for your participation, and good afternoon, everyone.